I'd like to thank CANSA for inviting me to speak to you about something that I've been passionate about for over 10 years. It sounds like a lot of people standing here today have been passionate about things, and it's quite nice to see the different passions that we have. I was asked to speak about Lindane because it's used on human health, but I'm also going to explain to you that it's used has been used quite extensively on other things. So briefly, what I want to present to you today as a picture is just what some of the key health risks are to do with Lindane. I'm not going to get too much into the chemical side of it, and that there has been extensive use and exposure to Lindane, that it's not just actually been for lice and scabies control. And what are we doing? What have been the legislative controls? What is sort of the history? You know, we've been discussing quite a lot of issues, and it's always in a context of policies and legislation to control some of these issues. And then looking at what are some of the risk communication vehicles. How does the general public find out about what the health risks are? What are the various risks associated with Lindane? And some recommendations to reduce exposures. So, as mentioned in the introduction, the findings of this was research that I did in 2007 when the Stockholm Convention that Rihanna mentioned was looking at possibly listing Lindane for global banning of use. And I did a socio-economic analysis in terms of what would be the implications if you actually withdrew Lindane in South Africa. But the Lindane that I'm going to be speaking about today is the gamma isomer. There are different isomers. There have been different isomers that have been listed on the convention. But I'm going to be speaking about the gamma BHC one, particularly that's been used in lice shampoos and for scabies. You will see that it's a very old pesticide. It's been around for a very long time. It was first registered in the US in the 1940s for agricultural use, and then in 1951 for pharmaceutical use. So it's quite an old chemical that's been around. I wanted to present you with the health risks first before I get into the uses, so that you can keep these in mind when you look at the broad spectrum of use of Lindane in South Africa, and try to keep in mind what some of the health effects are and the exposures that people have had. And I assume that several of you have had as well. So in terms of acute toxicity, the WHO classifies it as a moderately hazardous chemical. And it has actually an enormous amount of health effects, which I couldn't even begin to touch on. But just to give you a range, it's from mild skin irritations, dizziness, headaches. One of the big ones is seizures, convulsions, and death that has been associated. It's a neurotoxin. That's how it's meant to kill the insects that are exposed to it. It's immunotoxic, has reproductive effects, developmental effects. It's been associated with hair loss and with aplastic anemia. Another interesting point about Lindane is that the immune system is most affected by exposure to Lindane at all doses. And also important to remember, not just with Lindane, but with all pesticides, that malnutrition is shown to increase effects of pesticide poisoning. And this is particularly important for the populations exposed to these chemicals in South Africa. In terms of the cancer risks, it's been predominantly based on animal studies, and it's been difficult to, as we've heard already today, to make causal relationships with some of these chemicals. But in 1987, the International Agency for Research on Cancer classified Lindane already then as a possible human carcinogen and put it in group 2B. In 2001, the EPA had said that it was suggestive evidence of carcinogenity, although the WHO, which seems to be, as we heard earlier, a little bit more conservative, indicated that Lindane is not likely to pose a carcinogenic risk to humans. In 2009, the information insert that you pull out of the lice shampoo, the Gambex, on it, it says, may have carcinogenic potential in combined exposure to co-carcinogens. So we're left not knowing, other than we shouldn't expose ourselves to it, and we need to protect ourselves. So let's look at the uses and then how we're trying to protect ourselves. So until 2009, when agriculture uses were stopped in South Africa as well as other uses except for on health, it was used extensively on humans for lice and scabies control, used in animals, veterinary use for ear mites, fleas, mange. It's a broad spectrum insecticide, so there would have been food residues. It was a wood preservative. If you look at the pictures, you can see some of the products, and you used to be able to go in the local hardware store and buy it as a wood preservative. And it was used extensively in commercial pest control operations. So if you had termites or wood borers in your home, they more than likely would have used Lindane for the control of that. I'm not going to go through all of this, but these are some of the products, just to give you the range that up until 2009, Lindane was very accessible in terms of a household insecticide and wood preservative. And there we have some more. Perhaps some of you recognize some of the names. Diant, Blue Death are all very popular products. As I mentioned, it was also used in veterinarian control. And you could even buy 2 products on the internet, which I was quite surprised about. So what is the history in terms of regulating it? Well, if you look at it in terms of the Department of Agriculture, the Department of Agriculture regulated the wood preservatives, the pest control operations, and the agriculture uses of Lindane. So in 1970 already, use in aerosols and evaporation devices was withdrawn. In 1971, all stock remedy registrations were withdrawn. That meant in 1971 you could no longer dip sheep or cattle for ticks or any insects, but you could continue to dip children until today. You can still dip children with Lindane. And as you can see, there was disposal of Lindane containing stock remedies was prohibited. Disposal prohibitive and stock remedies containing a mixture of different isomers. So the restrictions for agriculture started coming in quite early. And in 2007, the Registrar of Pesticides issued a letter indicating that all registrations under the Department of Agriculture would be withdrawn in 2009, which they were. And that was to comply with the listing of Lindane on the Stockholm Convention, which came into effect in August this year. But this is the Department of Agriculture. The uses of the lice shampoos and the scabies lotions is under the Department of Health. It's registered as a medicine, not as a pesticide. It's labeled and handled as an over-the-counter medicine until 1990. So, 2009. And you can see, if you look at the pictures there, you could walk in the store and you could look for various control measures for lice and scabies, and you would get the Gambix, the Qualidia, the Nix, which was all Lindane containing. It was Scheduled 2 at the end of 2009, which meant it went behind the counter. So it's still available, but it just means it's no longer you can just walk in and buy it. It was never listed as an essential drug for lice and scabies, and it wasn't available in the public health sector, which is very interesting. Because it was too expensive, it meant that it wasn't actually being used on the general population. It was actually being used by people who were in a higher socioeconomic bracket who could go and afford the 50 Rand, the 40 Rand for these products. So indirectly, the general population was protected from exposure to it because of economics, that it wasn't listed as an essential drug.